Hi, welcome to another edition of MD Insights. I'm delighted to be here today with Patricia Hirkala. Trish is the director of all of our APPs in our Digestive Disease and Surgery Institute, so we work closely together on a number of projects and areas. Trish, welcome.
Thank you, Dr. Delaney, for having me. It's a privilege to be here.
Oh, not at all. It's great. It's continuing the partnership. So, tell me, why did you pick advanced practice? What led you to this profession before we even think about specialties and other things like that?
Sure, of course. First of all, I always gravitated towards medicine. I probably could bring it all the way to the show MASH, Hawkeye, if anybody remembers that show. I just love that show and always wanted to be in surgery. My first love was always surgery. I started out as a surgical technician, and it was in that practice that I first met a physician assistant and gravitated towards the role then. It was after that role, surgery was always being my first love, and it's interesting how life takes you full circle. I've been a physician assistant for over 30 years, and I started out in colorectal surgery and vascular surgery through interventional radiology, and here I am in Digestive Disease Surgical Institute. So it's interesting how life has taken me full circles as the director of a surgical institute.
Yeah, it's we're just delighted that you've brought all that experience to us, as well as your leadership experience, because the way you've interacted with the team has just been fantastic. So tell me, what's your vision for what the potential is, I guess, really, for physician APP partnerships as we develop medicine and scale medicine and modernize how we practice going into the future? So what's the Holy Grail?
Oh, the Holy Grail, we're always, as I stated, being a physician assistant for many years, I've seen the evolution of the APP practice, or advanced practice provider practice, coming from being able to write prescriptions to schedule true drugs. I would say the Holy Grail is finding that sweet spot of that top of license practice, and with collaboration with physicians. I would say the Cleveland Clinic has been part of blazing that trail. DDSI has been with leadership, always looking for that sweet spot, finding that top of license, that practice, finding where we are working in collaboration with what the laws allow us to do through the Ohio State Medical Board with physician assistants, where they are governed by, and the Ohio Nursing Board, where nurse practitioners are being governed by. I think as we have been evolving, finding our top of license where we are working in the procedures, where we are working for sedation laws, it's hard pressed to have a patient go through the Digestive Disease Surgical Institute and not be touched by an advanced practice provider in some capacity. People have said to me, we have almost over 100 APPs alone in the Digestive Disease Institute, and said, gosh, isn't that difficult managing, that volume? It's not so much the volume that DDSI has, it's the diversity that we have. We have, high functioning trauma teams out at Hillcrest. We have high functioning colorectal teams who are blazing the trails with what they're doing innovative. But finding that sweet collaboration with physicians, augmenting their practice so physicians in turn can also operate at top of license. It's not about solely the APPs, it's to have the physician, the surgeon, allowing them to be in the operating room more, having the APP being able to augment their clinics so they too can be at top of license. So it's strictly a collaboration, not strictly, it's a collaborative effort to find that sweet spot for that Holy Grail for APPs.
Yeah, and I think it's a collaborative learning experience as well, because probably like many healthcare specialties, a lot of physicians are fairly conservative, and we go in and we train in one way, and then to think about changing our practice is very different to what we've ever done. So I think many people from the physician side of things just don't even realize the potential, both in the capabilities of APPs, looking after patients and practicing independently, but also what that allows physicians to do and how they can scale their practice.
It's a learning process on both sides, absolutely.
Yeah, absolutely, and it takes time. And I think one of the other things that people often don't realize enough is the importance of training for the APPs. So your 100 plus APPs are not interchangeable, they're all subspecialty trained.
Right. That's interesting that you bring that up, Dr. Delaney. When one of the pluses of being advanced practice provider that has been touted for years has been, well, I can go into, let's say, emergency medicine for 10, 15 years. If I get burnt out a little bit, I can maybe go in an outpatient practice setting. But the culture is slightly changing as we invest more and more in our advanced practice providers to become more and more specialized, as we're teaching them how to help assisting with the robot, how we're teaching them to do more procedures. I'm fortunate also to work with interventional radiology teams as we teach them to do higher level procedures. This is capital, and this is investing time into that. We're not seeing that shift so much anymore in our APPs. They're starting to become lifetime committed to their specialties. So it's interesting that you bring that up, that PAs are becoming more and more invested as a specialist in their field as well, which is wonderful.
Oh, absolutely. Yeah. So we couldn't switch a trauma APP to going out and doing outpatient inflammatory bowel disease medicine care.
Yes.
Right?
They have that ability, but they just don't do that as much anymore. Yeah.
Yeah, and it takes time, and it takes a little bit of subspecialty content expertise, and it's different for each subspecialty. Now, doing procedures, I think, is really something that is being scaled. Obviously, hepatology groups, paracentesis, radiology, who you worked with. Where do you think that end will be? Do you think in the US we're going to get to the level of Europe, where they often have advanced practice nurses even doing endoscopy or colonoscopy for certain cases? Obviously, that's not permitted yet in the US for that thing. But where do you see that going? What direction and how far?
There's been thoughtful dialogue on both sides of the fence. I am for the growth of the advanced practice provider, but we have to be smart about it. First of all, what is the driver for doing that? Is it just because, I can teach them to do that? Of course, we have to do that. But is there need for the patient for that? Are we doing that to increase patient access? What is going to be the governing body for that? We have to have a physician collaboration, absolutely, with that. APPs cannot act unilaterally on that. Physicians are the key process into making that a successful venture.
We've worked with your team integrating seeing new patients, seeing follow-up patients, independent clinics, and that's really been helpful as we've tried to transition people into the operating room.
Absolutely. Absolutely. Into more into independent clinics. It's also, when you are looking into more independent clinics, the patients have to be aware, part of that branding, that of who they're going to be seeing in the independent clinic. It's very important that as patients are introduced into the APP as part of the team, when they're coming in, we want them to be aware that the physician isn't going to be part of their maybe their preoperative teaching, and that the APP, the nurse practitioner, the physician assistant, or the CNS is going to be doing their preoperative teaching. More and more, it's becoming more of a common speak for patients to say, I'm going to be seeing my PA today, and not my surgeon.
Yeah, I think we're making absolutely a lot of progress around that, a lot of progress. Tell me, what about virtual visits? And that's another way that we can obviously scale care and scale health. How do you think that's working for advanced practice teams?
I think it's working very, very well. Of course, the pandemic, kind of throttled the virtual visit onto the front, to the front lines as where healthcare is going. I think where it is landing afterwards, or as things kind of reintroduce into a more of a normal state, we're finding out that patients are obviously more and more comfortable with a virtual visit. Depending on what the chief complaint is, patients, I think, quite like it. I think it's here to stay. It's going to settle down into what cohort is more comfortable with a virtual visit. But I know my APPs were a little bit reticent in going into this realm. It's amazing the turnaround in the last 6 to 8 weeks of where virtual visits have landed. I think it's here to stay, though. Oh,
I think it surely is. Yeah, it's made care so much more streamlined for a lot of patients, even if it's people who live locally, let alone those out of state. They don't have to drive in, they don't have to park.
Right. And you just don't feel good sometimes, and you don't want to come down to the doctor's office.
Absolutely. So, Trish, I want to thank you very much for taking time to chat with me this morning. It was great hearing your thoughts about how we continue to partner better and hopefully let others see how our APP teams are functioning. Really appreciate your leadership and your guidance for your team and your constant interest in partnering with us as physicians as we try and improve care that we offer our patients. Thank you very much.
Thank you very much. Thanks, Dr. Delaney. It's been a privilege.